Hello, we have Houston-based cosmetic surgeon Dr. Nikko joining us, and he's agreed to answer a few questions regarding Botox.
Hi, everybody.
Hi, Dr. Nikko. Thank you for joining us.
Thank you.
Our first question comes from Kathryn. She wants to know, how long do Botox injections last?
Yeah, the most common questions for Botox. How much does it last? Besides from how much does it cost? Before we started years ago, over 10 years ago, 15 years ago, when I started injecting Botox, we were telling patients 6 months. But now we're telling patients 3-4 months. Given that range, I think 90% of patients fit in that range. We do have an occasional patient that will last 6 months. And we do have occasional patients say, 2 months and I'm starting to see the wrinkles. And so you have to tell every patient, typically 3 or 4 months, your metabolism is a little higher, it can be a little less. So you want to prepare for each patient. And then secondly, what I find is that a lot of patients are, we're all cost conscious. And so they want to spend just the minimum possible. And so when that happens, I tell patients, look, if I'm not giving you the full dose, it may not last, 4 months. It may last just a couple of months. So I think patients' expectations, spending time with them, educating them, that whole process is key when it comes to giving Botox treatment. Running people through the mill and just really not paying attention, it sets people a lot of people up for false expectations, and they're unhappy. But I find that you spend a little bit more time and you tell them, look, if you got a budget and we're only going to spend a certain number of units, then it may not last as long, and they're happy.
Okay, Nancy wants to know, if I get Botox shots, is it going to hurt?
I would tell you that 99% of the patients who get Botox from me and from my physician assistants would say it did not hurt as bad as what they have gotten at other places. Now, cost, like I said, is the most important factor, I think, for a lot of Botox patients. But there are nuances. There are things that results that are, or how much it hurts, or the amount of bruising involved after. Those little things makes a difference. So if they are important to you, then I think it's worthwhile spending a little bit more. But if you're looking for just the cheapest thing, then I think that you can expect maybe results that are a little bit not as good. So you just have to be aware of that.
Okay, our next question comes from Paula, who's recently moved to Houston and has had Botox injections for 2 years, but needs a new doctor. How much do you charge, and do you have any packages?
Yes, we typically have we stay competitive because we know that everyone is competitive with their Botox prices. Typically, for new patients, we charge about $12 a unit. And when patients are returning, then we charge them $10 a unit. And that price may change depending on competition. But I try to stay at that level, and I know some people will go a little less, but I can tell you then you start, again, you have to sacrifice something. And typically, quality is the first thing. And so, but we do have special packages. We actually have a membership program that people enrolling where they can get Botox right now for $8 a unit. So we have things that are a little unique that offers patients, hey, look, if you know you're gonna get Botox and you want quality Botox, and you get it for as low as $8 units right now.
Okay, our next concern comes from Nicole, who says, I've seen some people get too much Botox and they lose their expression. Is this possible?
Yes, it's Nicole, it's absolutely possible. You've seen people, you've seen friends, you've seen people on TV. Botox works to relax the muscle, facial expression. The more, if you give a big dose and you give in a large amount and you give it over a large area, you can inhibit almost all the muscle facial expression. To me, it's a little bit unnatural. I my personal preference is I will do what each patient asks me to do to a limit, to an extent, because I don't really, at the end of the day, yes, it is selfish, I guess, of me to do what I think looks good, and I don't want people to go around saying that Dr. Nikko did my Botox and it doesn't really look the way I want it to look, and that's the art of it. I like people to have a little movement in their forehead, just enough that doesn't create the deep creases, but enough to kind of move their brows a little bit. Maybe just tiny little lines come up around the crow's feet, just a little bit. So I like a little movement because it's natural when people smile and natural daily expression. But I certainly do enough to inhibit the lines from forming. And so that's the art of it. And the fact that there's a technical part, injecting it in the right muscle to get the results you want. But the artistic part is you get to play around with doing different things that create the unique style that fits you. And the style that fits me is the one that's more natural, little movement. Some people, I have a few that said, I don't want any movement. And I do for those patients, but those patients that typically come to me, they're more of a natural type of patients.
Okay, our final question comes from Donna, who wants to know, where is Botox applied and how does it work?
Okay, so Botox, it's applied, depends on the area of concern. The number one region is basically the frown line area. You can see, my kids, they see that a lot every day. So I like to keep it. And that's the number one. But, obviously a lot of women, they don't really like that because it makes them look mean, and you don't really like to see two lines that form there if you keep doing it. And once the lines are formed, they're kind of a hassle to remove. They've got to put a filler in there. And so the first area is this right here. And so there's a set of muscle that causes that, and basically it runs this way, and then so we relax those muscles. Some people don't like a line running across, and that's caused by the muscle running here. And so we relax that muscle. Now the forehead lines are unique because they forms the line in the forehead, but they're important because they hold your brows up. And some people, they just completely knock out the forehead muscle, the frontalis, but then they start to feel really heavy on their brow. So they don't, a lot of injectors don't understand the critical idea of balance. The brow muscle, which lifts the frontalis, which lifts the brow, has to be balanced with the muscles that are the frown line that are bringing down the brow. So if you're gonna work on these lines, you definitely have to work on the muscle down here to let it release up a little bit. And of course, you have your orbicularis oculi, the muscle around the eye that causes the crow's feet, and we relax those muscles that way. It's not so accentuated. I like to have just a few crow's feet. I think it's kind of cute, a little bit, but some people just don't want it at all, and I think it looks, the smile becomes a little bit, you can tell it's not completely natural. You sort of can tell. And then the last part is, some people do get it down here in the corner of the mouth because it does help to lift the corner of the mouth up a little bit, and that's kind of popular too. Another the area that a lot of people do is some people actually have they bite down a lot, and so they have these muscles, the masseters are very strong. And so they have a prominent masseter, they get some jaw pain, and if I inject it in this area, actually kind of slim down the face a little bit because the masseter is not as prominent, and they actually feel relaxation in that area, which they love.
Well, thank you so much, Dr. Nikko, for taking the time out to answer these questions about Botox. I know a lot of women who are interested in the procedure. Yeah,
it's a very popular procedure, but I think there's unique aspects that can be done well by someone who has a lot of experience in it versus someone who has a little training and you can get cheaper. I mean, I definitely think I see a lot of patients who come in or are converted, and so I definitely know there's artistic side. And if you have any questions, just give our office a call, 713-960-1311. I really appreciate it.